today to do an OSHA mandated, very important in-service about bloodborne pathogens, infection control, and personal protective equipment. OSHA is the Occupational Safety and Health Administration, and it is the federal government agency that regulates employees' health and what we have to do to provide for your health here at GA. The bloodborne pathogen standard is that occupational exposure to blood and body fluids may result in contracting illness. We all have the potential to be exposed to blood and body fluids every single day because we work with live human beings. With this in mind, the bloodborne pathogen standard was designed to protect us from unnecessary exposure. Everyone needs to know and understand that this standard gives us the information to protect ourselves and each other. This is just an example of someone who's had an accident, and see how they're wearing gloves and being very careful when touching the blood. Bloodborne pathogens are microscopic, which means they're teeny, teeny, tiny. So we can't see them. There could be blood spill and gross stuff on the table, and oops, I just touched it. So before I touch my mouth, my eyes, my nose, I need to make sure to wash my hands. All of these things are capable of causing disease: human blood, blood products, semen, vaginal secretions, saliva, and any situations where we can't tell what it is. Somebody spilled their water and a kid peed. We don't know which is water and which is urine. So all of these things we have to be very careful. The simple rule is if it comes out of someone else, it's potentially infectious to you. Same thing goes for sneezing and droplets of respiratory secretions. We have an exposure control plan because we here at GA are thinking of all of you. And the employees are required to have the written plan, and it's accessible. You can see me for it, you can see Liz for it. The plan covers anything that we can come into contact with and expose ourselves to. And the exposures aren't the same for all of us because housekeeping maybe has more of a risk of touching certain things that have to do with linens or spills on the floor, and the child care staff maybe have more chance of getting spit on, those kind of things. Within these classifications, there is a list of tasks and procedures which may result in occupational exposure. The exposure determination must be made without regard to PPE. We provide the PPE. The PPE is personal protective equipment. The most basic thing that all of us use is gloves. You use them when you go through like the kids' bags or when you're touching something or touching needle control kits, any of those things. But we also offer masks to clean up a blood spill, booties if you're cleaning up like vomit and it's on the floor, aprons if needed. Use standard precautions. Remember that the reason we use standard and universal precautions is that we don't know what kids have. Sometimes some of us know things that others don't, but there are things none of us will ever know. If a kid refuses to get their PPD test, we don't know if they have tuberculosis. We just have no way of knowing. So we have to treat each and every staff member and each and every youth as if they have every disease you can think of. And that means we're not discriminating, we're universally protecting ourselves. Hand washing is super important. I know I've seen a lot of people use the hand pumps to kind of sanitize their hands, but remember, nothing combats bacteria and viruses on your hand like running water and soap and the mechanical rubbing them together. When you wash your hands, you can sing like row, row, row your boat or happy birthday in your brain, or just sing it out loud, and we can all join in. Scrub for 20 seconds, rinse thoroughly. This just shows the personal protective equipment. We provide that for you, and you should always wear gloves when you kind of don't know what you're getting into. And this just tells where they all are. Ignore the soap part. We don't have a soap anymore. There is a blood spill and I have to clean it up. So what would we do if we had to clean up a blood spill? Does anyone know? We could ask the housekeepers or maintenance to help because when they're here, they're the experts. We could put on, yes, get a blood spill kit. Very good. And that has in it a special sanitizer, it has gloves, it has all the things you need to clean that up safely. And remember, when you're done with that, if it's a small amount of blood on a small like piece of tissue, you can flush it right in the toilet. If it is a large amount, you have to find a red bag. Gloves must be worn. This just talks about removing the glove. Remember that you can clean up or do anything you want with gloves, but if you take them off and touch that, you're still getting contact with it. So flip them inside out as you take them off. If anybody wants to practice that, Nurse Darla and I will help you. You can come and see us right after. Gowns cover your clothing, face shields cover your eyes, and booties cover your feet. The contaminated material goes into the red bags. If it is something sharp, like a piece of broken glass and then a kid cut their hand on it, you're cleaning up the blood, but you also have a sharp object, so put it where you put the razors, or come and bring it to us. We'll put it where we put our needles. There's a biohazard room downstairs. The people that have the key to that are the PM or weekend campus administrators, the housekeepers, or the nurses. Any hazardous material should be disposed of by the maintenance personnel. So don't try to throw a red bag in with regular garbage. Leave the sharps containers. All of the housekeeping staff are trained on how to take care of that. This just is an example of what a sharps container is. If you have been exposed, you have to complete paperwork. There's the employee incident report that is found on the intranet under Human Resources, Workman's Comp, Employee Incident Report. The reason it's located there is that Workman's Comp pays for the care you'll need if someone bites you, spits on your face, those kind of things. Oh, excuse me. This just shows the kind of form that we fill out and what we might have to mark and how we were exposed. You should always wash the site with soap and water. If it is bleeding, you don't need to stop the bleeding. Your body's trying to flush out white blood cells through your skin to help combat anything that has gotten in. Eye wash stations, super important, especially if you get blood or spit in your eye. The eye wash stations are available in the nurse's office. In the science lab, well, we have the sink. We can maneuver. We don't have the official eye wash anymore, but we still have the good high pressure. The science room. Occupational Health at WCA is who we use. This is their phone number. You can always call them directly, or you can call HR or me, and we'll call them for you. Documentation regarding a plan to reduce the likelihood of future incidents is done. That is the supervisor form that all the supervisors complete, saying if someone had spit in their eye, the next time they should turn away. Just those kind of little suggestions. Record keeping. We maintain our sharps log for 30 years over in HR, so if anyone has been poked, punctured, they keep that for 30 years because that's what the law requires. And it is kept confidential. So protect yourself. Remember that OSHA defines occupational exposure as reasonably anticipated exposure. And remember that every single one of us walking into work, we have reasonable risk because we are working with human beings. And you know you're at risk because you work here. What methods are used? This just talks about the engineering controls, meaning we don't leave out a big knife that kids can cut their hand on. We don't leave out tripping hazards so people fall, split their lip, and need to be cleaned up. Personal protective equipment is available if needed, and the housekeeping practices include the way we do our laundry, the disposal of things in the red bag. And everyone who works here can get the hepatitis B vaccine for free. This should be expanded. Now there is multiple vaccines. LSS still provides this one, but the local county health department will provide you with any vaccine you need free of charge. Hepatitis is an infection of the liver. You can tell someone has it if they're fatigued, yellow skin. It's like they have the flu. And hepatitis can lead to liver cancer. There is hepatitis A. We hear about this on the news like once a year because it's when people have it in their body. They don't wash their hands after they use the bathroom. The fecal material gets into your food and you get hepatitis A. This has happened like at Taco Huts, Hills, when we had a Hills. It's happened several places, so it's something to be concerned about. Hepatitis B is the most common type. There's also hepatitis C, D, E, F, G. It goes on and on because there's so many variations. HIV, I think most people these days know what that is. It is the virus that causes AIDS. The transmission occurs through infected body fluid. HIV is more deadly than hepatitis. However, it is harder to contract. It is far more likely to contract hepatitis. The primary infection is from sexual contact normally, or from mother to infant, and then kids are just born with it and come to us already with it. And then there are just all kinds of ways. Anything, and remember, it's important that we treat each and every staff member, each and every youth, as if they do have these conditions. Because what has happened before is we have kids who disclose conditions and suddenly they are segregated and treated differently, and that's incredibly inappropriate because we use universal precautions so no one is ever segregated. Hepatitis is more contagious. We've already covered that. Both can be spread through blood and sexual contact. There's less than a 1% chance of contracting HIV without sexual contact. Hepatitis is the hardy one that sticks around. Tuberculosis is a respiratory illness. It's a disease of the lung. It's the reason you all get your annual PPDs from me. We're checking for exposure to tuberculosis. Tuberculosis is common in areas like residential housing where kids live kind of on top of each other, government housing, those kind of things. Tuberculosis spreads rapidly through those housing environments, and we often have kids who go home there on the weekends where they're at high risk for contracting it and bringing it back. Symptoms include coughing, chest pain, shortness of breath. It's again like the flu. And 1/2 of all untreated cases are fatal. Years ago, we had a man who worked here who had been in a TB sanatorium because they used to isolate people who had this. It's highly contagious. And it's transmitted from person to person because of the respiratory droplets. It's very easy to catch, which is why we test.
So if a kid was refusing to take it, should she not be able to come?
We have made that argument, and usually the court will not remove them despite refusing to comply with our requests. So we do make the argument in those cases, but it's not always met with success. Active tuberculosis, that is when you are contagious. Often people come and say, there's blood in my hands from when I coughed. That's a very big sign of tuberculosis. If someone coughs, those respiratory droplets will be containing blood. And it can be widespread through your entire body. And this just shows the PPD, which you all have had. And if someone is positive for exposure, we simply do a chest x-ray every year to make sure that the dormant tuberculosis is not becoming active. And PPD stands for purified protein derivative, and that's how we test, and that is not active. You cannot catch tuberculosis from the shot that I give. And we do that once a year after the initial physical. Recap, that means we're close to the end. Standard precautions prevent the spread of infectious disease. Engineering controls are keeping things off the ground and not letting the kids trip, those kind of things. Using PPE protects us, housekeeping practices protect us, and we do have the free vaccines. You can get them here or any local health department. Occupational exposure, when infected blood enters the body through a break in the skin, is how we can have that happen. I like to cover latex allergies here. These days, most things are made without latex. However, just a reminder, a lot of our kids get the flip-flops at the dollar store. Those can have latex in them. Allergic reactions from latex allergies can include anaphylaxis, where kids have throat closing. So just be cautious if you're bringing anything in that may contain latex, because it's everywhere. And I do believe that is all. Do you want to take the test? No, I don't think we need to take the test. You guys did awesome. Thank you for coming.